afternoon. I'm Dr. Brendan Dowd. I'm a trustee member of the American Dental Association and past president of the New York State Dental Association. I'm also a clinical assistant professor at the University of Buffalo School of Dental Medicine. The important point I think everybody should remember is that we really want the fluoride re-upped in the water system as soon as possible. That's the important critical point that we have to get ahead. If it gets back to 0.7 parts per million, we'll be very thrilled, and the sooner the better. That's the goal. I know it's been 7 years since we've had fluoride in the water. That's certainly indicative of many problems that we're going to obviously discuss, but right now, if you ask me, the most imperative point that we have to think about is getting that water back to where the proper concentration of fluoride for the citizens and especially the kids of Buffalo. Thank you.
Good afternoon. My name is Joshua Hutter. I'm the president of the 8th District Dental Society. I was also a former part-time instructor at the UB School of Dental Medicine, and I currently practice full-time in a qualified financial hardship area. This topic is extremely important, especially the patients that I treat. Fortunately, for 7 years, for a lot of our patients, the drinking water, unfortunately, is the only source of fluoride or dental protection that they can get. So for 7 years, unfortunately, there's been no notice, no notification, or any type of consultation with any type of dental professionals, either regional, locally, state, or nationally, over discontinuing the addition of fluoride into the drinking water. Our ultimate goal is to make sure that the fluoride is instituted as soon as possible in order to provide our patients the absolute best care that they deserve. And that's it.
Hi, my name is Dr. Frank Partnership. I'm the Secretary Treasurer of the New York State Dental Association, which is headquartered in Albany. I'm also Professor Emeritus, Clinical Assistant Professor Emeritus at the University of Buffalo School of Dental Medicine. My focus today to the Council was presentation of the notion of how fluoride is handled under New York State's public health law known as 1100A. It calls out for a series of notifications and consultations, which the city has really not done at all. They are called upon by state law to consult people who know about fluoride and how alternatives to fluoridation can be enacted if there's a discontinuance of fluoride. As a dentist, I was shocked when I read the news article 2 days ago, jumped out of my chair, and went into action to correct this omission that impacts the health of all citizens of Buffalo, including adults, but especially children. This action was taken by the City Water Board in almost complete secrecy, to the detriment of the health of the citizens of Buffalo. My point that notification was incorrect and was inadequate should be followed up by the fact that we need to restore water fluoridation today, not at the end of the year, not next year, but today.